Welcome to Showcase Richmond. I'm Matt DiNardo. It's a topic no one wants to talk about, but when the time comes and a loved one is facing end-of-life concerns, knowing about a caring, educational, supportive, and nearby hospice can make a big difference. Crater Community Hospice provides full-service quality care and supportive services, as well as education to both residents and their family members. Crater Community Hospice is the focus of our Good News segment, made possible by Care Advantage, changing our community one charity at a time.
Care Advantage means that I can face each day with a positive. You don't have to go to bed at night wondering, I'm gonna get through tomorrow, because you already know they will be here to help you get through that day. They care about the people they're helping. They're special.
Don't do it alone. Call Care Advantage and find the peace of mind you've been searching for.
With us now is Brenda Mitchell, the Chief Executive Officer of Crater Community Hospice. Welcome, Brenda.
Welcome. Thank you.
Let's first talk about and tell our Showcase viewers what Crater Community Hospice offers.
Well, Crater Community Hospice is a community-based nonprofit hospice program, and we're located in Petersburg. We offer full services of any hospice program. That includes nursing, social work, our aides. We have physician, medical director, chaplaincy services, volunteers, also a bereavement program that follows families after the loss of a loved one.
Because that is a very tough time for sure. Now, you're located in Petersburg, as you said. What areas do you serve? Well,
Crater Community Hospice, we serve all of Chesterfield, and then we provide services in the surrounding counties from where we're located, meaning the Tri-Cities, Petersburg, Hopewell, Colonial Heights, Prince George, Dinwiddie, Sussex, Surrey, also down to Emporia and Greensville County.
Now, what is the criteria to be eligible for services from Crater Community Hospice?
To be eligible for any hospice program, a person does have to, especially if they have Medicare or even no payer source, they do need to have an illness with a prognosis of 6 months or less. But that means if that disease continues to progress, or the trajectory of the disease is expected to be 6 months or less. But that doesn't mean that if a patient lives longer than 6 months, that doesn't mean that they cannot stay in the hospice program.
Gotcha. So it's really meant for those with a short-range terminal illness, and you're trying to make them peaceful at that point.
Of course.
Gotcha. Yes.
So
you mentioned Medicare. Does Medicare pay for everything?
Under Medicare, there is a hospice benefit, and this Medicare benefit covers everything that is related to that diagnosis for which the person is under hospice care. Of course, that doesn't mean that what we get from Medicare actually covers the cost of everything, but what we get from Medicare is what we accept, and that we don't, that takes care of all the services that we're providing to the person.
Now, you have a lot of support groups in Crater Community Hospice. Talk a little bit about those.
Okay, as I said, we are a community-based hospice, so we are supported by the community, and we are continually wanting to give back to the community for the support they provide to us. So we do provide support groups, bereavement support groups. We offer support to caregivers. We offer education to anyone in the community, also other resources. And with our support groups and our outreach, all of these things are available to anyone in the community. It's not specific to people who are being served by Crater. And
others can support you by making donations?
Of course.
Yes.
We're always needing support. Donations can be made to Crater Community Hospice. We, do other things to help raise funds. We recently have a thrift shop that we just opened.
To make the donation, you can give them a call at 804-526-4300.